Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And if you haven't seen, this is my 13-week-old French Bulldog. This is Juliet Pearl, and her nickname is Juju. And she is in training to be my therapy dog. And what we're going to talk about today is persister cells and biofilm. Lots of my patients ask me, Dr. Mara, what's going on with the biofilm and, what are these persister cells? Persister cells are cells that evade the effects of antibiotics. They're very, very resilient, genetically resilient. And Dr. William Consterton, I believe he was a dentist. I believe he's also passed now, but he was the first one to sort of talk about biofilms in the mouth. And then that was adapted to biofilms in the body. And the persister cells, if you think of a biofilm community as kind of like a mound, okay? And the persister cells are at the bottom, okay? And the planktonic cells are at the top. So they get killed off. The persister cells, they do not get killed off. And this is why some infections are difficult to eradicate. For example, some forms of staph, strep, Lyme, Bartonella, and probably a host of viruses as well. I'm not sure that viruses produce their own biofilm. I think they probably live in the bacterial biofilm, but definitely molds produce biofilm. And so the molds and mycotoxins are contained within the biofilm. So, when you have a patient that has multiple tick-borne illness, say Lyme, Bartonella, then they have a mold exposure. So then they've got another hit to their immune system. And then, they get COVID or they have the COVID vaccine. It's just repeated hits to the immune system, and the bacteria biofilm just begins to get bigger and stronger. The bacteria biofilm is made of mucopolysaccharides. So it's like a sticky, viscous substance. It's kind of like, for lack of a better word, it's kind of like snot. The organisms that are contained deep within the biofilm structure are the most difficult to get to. And so you have to use things that degrade the biofilm. And those things can include xylitol, Lactoferrin, sublingual heparin, Baluc, which is Lumbrokinase, Nattokinase, Serrapeptase. These things can degrade the biofilm so that the herbals or the antibiotics can get in and really get to the organisms that are causing persistent infection. Getting rid of persister cells is a full-time job. It's a lot. Those little buggers are so strong, and they are so resistant. And so Dr. Horowitz has been working on double dapsone protocol, which may shed some light on getting rid of persister cells. So he's in the process of doing a double-blind study, I think with UC Irvine, and maybe a couple of other Juju, come on, maybe a couple of other universities. And hopefully we'll get some more insight into how to get rid of these persister cells. But to date, they tend to be problematic for patients with multiple tick-borne illness and mold illness. So, things that you can use: xylitol, Lactoferrin, sublingual heparin, Lumbrokinase, Nattokinase, and Serrapeptase. You should do this under the supervision of a doctor, but these are the things that will help degrade the biofilm and make the persister cells more vulnerable. So I hope this information has been helpful to you, and I hope you have a wonderful day. Bye-bye.